was enough on Eudora too, on all the historical societies, or is there anything else specifically we want to say about the Eudora request?
Well, I'll just add, I talked with Ben specifically about it. I think he's worried about the stability of his funding from the city of Baldwin a little bit, but I also know we can't make up for that. He's just you know, got all of the responsibility on a relatively low salary that and he's been there for a long time, and he has actually a pretty remarkable resume at this point. So I don't doubt that he deserves a raise and a kind of a serious adjustment in his salary. I also know that he understands that this is a particularly unusual and rough time on the budget, so he's very understanding about that as well.
If there are no other comments, we can move on to the Heartland request. And the only thing I would say here is, obviously, if the commission wants, we can put some percentage of the request into our sort of CARES Act Part B funding, if that's, but I don't believe this current request meets the criteria for CARES Act. It would need to be a different, they would need to make a different ask for CARES Act.
Sarah, can you speak to, I was surprised to hear Robin say that she thought this was a one-time ask.
Yeah,
that was surprising to me, and I guess I'm motivated to fund it mostly based on our Douglas County health equity. You know, I think this starts to address health equity by providing more care, and I mean that's really what pushed it for me and saying let's find the money for this. But I was really surprised when she said it was a one-time ask.
Yeah, I was too, but you know, her explanation of it being a, you know, kind of a first-year startup until they got clientele and clients and everything and got everything under their feet. It's like, well, that, I mean, to me, it seems like a pretty smart one-time expense.
And that's been the pattern for the behavioral health dollars that have funded new psychiatrists, is that the funding is less and less necessary as they get their patient loads and their billing up to speed. So it made sense to me as well.
I think it does. And I feel obligated to sort of play devil's advocate on it. It's also easier sometimes for partner agencies to ask for something one time, and then you've gotten used to this service and you don't want to cut it when they aren't able to accommodate for it. And if this particularly is a primary care team that is going to be dedicated, or, you know, really coming out of the fact of the uninsured population, you know, the difference with psychiatry is that there is dollars for psychiatry and there are Medicaid dollars for psychiatry. So those folks are all paying clients. So the need is less. If this is a situation where it's going in to provide care for uninsured clients, I think there's a high likelihood that they won't be able to secure funding for it. And you would have this request in the future. So maybe I've just been around too many budgets and I'm a grizzly old veteran, but sometimes it's a strategy to try to get in a budget and get continued funding. I'm not saying that's what Robin was saying. I'm just saying that it's off. My fear is if they weren't able to come up with funding to be able to cut a service. So do you want us to put this, like this notion of 33% of what the ask is in this, the CARES Act funding, or is there?
I don't see how this is CARES Act money. It just doesn't make that connection for me. I'm willing to take it out of one-time money and take the risk that they never come back again. You're probably right, Sarah. You probably are right, but I think we have major health equities in this community that we need to keep working to address, and this seems like a way to address it. If she says it's one time, then it's on the commissioners to, when they come back next year and want it in the budget again, we have to say, hey, I thought this was one time. You know, I mean,
I do have to say that, like, Heartland is substantially hurt by how close we came to Medicaid expansion in this state, and how that was another victim of COVID-19 and the legislature changing, and Medicaid expansion radically changes things for Heartland, for VNA, for others of our partners. And I do think it's something that, you know, when, you know, my hope is when, not if, that happens in this state, you know, maybe some of what has had to happen at the local level to support these needs could be repurposed for other, to expand or to do other things. But that's a significant part of what our funding at VNA goes for as well.
And I apologize. I thought I had included that on my budget, but I'm looking at it now and somehow I didn't, but I was supposed to. I meant to.
Well, then that makes us, we're hoping it would be funded. I'm fine with the, with Patrick's, I mean, that's a very persuasive argument that, you know, that if this helps with equity health issues, we certainly need to be part of that, part of the force that's working hard on that issue. And you know, Robin, you know, who knows what next year will bring, but I think in this moment, I think I'm going to trust her that she means it when she says it's one time. And you know, I think it, like Patrick and Michelle, I think I would be fine with adding it to a one-time expense from unallocated dollars or from the fund balance.
Are we talking about the full amount or a lower amount?
Well, wasn't the full amount 27,000?
Oh,
Yes.
So that wasn't really a third of the request. That was
sorry.
the request for partial funding partially of several different positions. That's the full request.
I'd say the full request.
One time.
Yes.
Okay. The next one is just food.
so no request that we had seems more aligned with CARES Act funding than this one to me. I mean, it is specifically to redesign, to maintain social distancing in the era of COVID-19. I mean, this one seems so cut and dry to be CARES Act.
Yeah, I agree, Commissioner, and I actually think that, you know, our hope here is the only complication that this could run into is that it has to get spent this year. So it is capital, and the rest of the funds they were looking to provide, they were planning to fundraise for. So, you know, my hope is that they ask for more than this request to come into CARES Act, and that we are able to get it accomplished within the timelines outlined by CARES.
Yeah, I'll be interested to hear, Sarah, I know you've got some questions to the state about this. You know, even during the break, I was thinking a little bit about our human services request, you know, and a coordinator for human services. you know, what things can we contract, you know, and say, okay, it's under contract, even with the human services coordinator, can we contract someone for a year, you know, so that money, I don't know. I mean, you know, I want to play by the rules, but I also want to push the rules a little bit as well.
What we are hearing for capital is that we could have a contract by the end of the year, but it still would need and we would have a little leeway into 2021 to have it spent, but it's still, I mean, it still really needs to be spent very quickly. So, and because if not, remember, any unused funds go to round 3. And so it's not like they're going to get swept to pay for pencils in the governor's office. They're going to go to round 3. So I think it's one of those things that, you know, they're trying to make sure they have money left for that fund as well.
It sounded to me like they've got, like Just Foods got the designs and are pretty far along in the planning for this. I mean, I wonder if it's not all that unrealistic that they would really be able to move quickly on getting it under contract and in a way that they're eligible for these dollars. You know, maybe not fully paid for, but enough to get that look from the CARES Act funding to help get started.
Yeah, I think that's my hope as well. So you all were supportive of it. Do you want us to include it, the 50,000, in that sort of, if for some reason it doesn't happen in CARES Act, that we would want to reconsider this?
Yes.
Okay,
Yes.
Yes.
So I'm gonna put it in and we'll talk about it in the CARES Act pool.
Yep. The next one is the Lawrence Community Shelter and their request for flexible rental assistance. We talked about this a little bit under ESC.
Yeah, I feel the same about it as I felt with the SC. It's the same, to me, it's the same request. Sarah, can you clarify for me? Last year, we spent a lot of time talking about Lawrence Community Shelter. And this year, we just rolled their supplemental request into their total budgeted allocation. Is that correct? I mean,
Yeah, I didn't get any indication from the commission that it was one
Yep.
time.
so yeah, just making sure that that we were clear, you know, when we talk about our total funding for the shelter, that is ongoing support for the shelter.
And I think there's that, but also I think it's important to remember that we still are paying, I mean, double check me on this, but we're still, the Douglas County Housing Authority still has our 100,000 for the New Horizon Fund, right? Which specifically helps get families out of the shelter.
Correct.
Just funding through the Housing Authority. So that's important in the calculation as well.
Correct. They actually get, yes, they're in our budget for 100,000.
Right.
We will put LCS in on that $50,000 for
This CARES Act pool as well.
yeah. Okay.
Sorry.
Next is Trinity in-home care. And I would say too that request changed from what was submitted kind of early CARES Act to what you heard last week. Their conversation about their private pay was something that when we were reviewing budget, we didn't really have at that point. But we've got commissioners that are supportive of it, sort of what appears to be in this sort of CARES Act. And I think if they can make a pretty strong case that their private pay dollars have gone down, and I would think they would have a pretty strong case as well. I'm not sure, because they don't have an executive director yet, that they've been able to really get engaged with the health and medical RSF. So I think that's something we can try to do on our end to try to get them engaged in that process as well.
Not to, well, I'll just volunteer. Maybe Megan Poindexter could help a little bit if she has the time and availability, since she does have the experience. But I was pretty shocked by the numbers they presented us with. So I'd like to see them make their case and hopefully get some assistance.
I agree.
I agree. I really feel for this organization, and I think this is a great example of how we need to be more aggressive in our human service coordination. And in some ways, at some point, do we need to play a bigger role in helping this organization? Because I feel like they're just going to come back to us again and again and again and again. And at some point, we've got to help them be on more sturdy ground, because what they are providing, no one else is providing. And it's not only critical for the care of our elderly and in some cases mentally disabled populations, but also for our workforce. I mean, if that group goes on, there's a large number of people who are working through Trinity in-home care. And I just think we have to maybe be a little more aggressive. They're having a hard time keeping an executive director. And I think that I just worry about this organization. That one seems ripe for the human service hub and for some more coordination on the part of Douglas County.
You know, I would really, one of the things that they mentioned was worst case scenario, having to sell their building, or, something I've been talking about for a couple of years is how can we get some of these groups together under one roof, and create some efficiencies that are going to save them some money. I still think that we have some options with the United Way building or the Ridge Court building. Are there other efficiencies they can look at, the ones that really don't have a walk-in clientele? So, the fact that they brought that up, worst case scenario, selling their building, I'm not asking them to do that right now. I think we do need to help them. But I think going forward, we need to look at how we might be able to save some of these agencies, some of their overhead.
Well, and along that line, it seems like a while back we were doing space evaluations in the Burt Nash and public health building, and seems like there was, maybe I'm wrong, but I feel like I recall that there was space around the VNA offices. That'd be kind of a natural alignment. But when you do think of how much we give to contribute to Cottonwood and the VNA, for their special populations, I think you're right, Patrick and both of you, that this is just such a critical organization, and so they're not known, and they don't benefit from a lot of the kind of philanthropic dollars that folks are so willing to spend on other agencies. And so I agree completely that we need to embrace this organization somehow and keep them sustainable.
A couple updates. So I have, after our budget hearing with them, I did have Scott Creaky reached out, and we're going to share with them some information about Ridge Court and the availability there. So we're working on that, and they've asked to have that by their next board meeting. So we're working on that. Nancy,
Okay.
you are correct. One of the things we were looking for was, is there room inside the community health building for another client, particularly with DNA has downsized, and also as Bert Nash will have some movement of staff as we build the crisis center. So we had talked to Gould Evans about doing that analysis. So there are some possibilities there. So we'll continue to work through that. I would say in terms of Trinity and you guys, you're right. I mean, we as a county, we have provided sustaining support to several key nonprofit and human service providers in this community that the commission has felt that it was strategic to support. And I do feel like Trinity is on that list. I think it's one of the things that, when I mentioned in the hearing, talking about the role of Trinity to the Human Services Coalition, I think there are a lot of other human service partners that just assume Trinity is going to be there and do this work for them, and in a way that they may not completely understand how dire their financial situation is. And that I think those agencies should also help rally around Trinity and the work it does in the community. And many of them will tell you that when you have conversations about it, but it hasn't really capitalized on being able to support the agency. I am really worried if that agency were to fail, what would the impact would be on some very vulnerable Douglas County residents. So we'll continue to sort of explore how we can have those conversations. And I do think it's one of those things that as commissioners, you think about these things and you think about human service planning, and at some level, it may mean some realignment of some dollars at some point from agencies that, while they're important and valuable to the community, may not as desperately need the support that another agency might.
I agree. So is that, Sarah, do you feel like we have enough of a link conversation going with them that we will, if they are truly in danger of shutting their doors, we'll know before that happens and can intervene somehow to, we're in close contact.
I think so, and we can state that again to that board as they bring their new director on.
Yeah, I think we need to do that. Thank you.
All right, so we'll put it on that list. Next, I have the Child Advocacy Center.
Yeah, so I know that this proposal, they don't have their business plan complete. There's some options out there. Once again, like where it could be. There were some comments and suggestions on that. I'm not saying, necessarily give it all to them now, give a portion of it to them now, but I'd kind of like to have a placeholder, because I think this is a really important, if we're going to start talking about, kids and their future, and, we need to be protecting our children. And especially coming out of COVID, I think that there's going to be a lot of issues, because some of these kids haven't been going anywhere where there's somebody that's going to report that there's an issue. Kids getting, taken from one place to another, and they're already traumatized. I think that we need to look at something to create a warm, safe place for them to be, where people come to them. And so I know it's early on in the conversations, but if there's a way to kind of put a placeholder there, or say, get your plan in place and we can give you some startup, or we can try to find a place for you to be located. I just want to make sure that this doesn't get lost in the shuffle, because I think it is very important to how our kids' lives move forward.
So I'll jump in. I didn't put money down for them yet, only because I thought that there were more details to work out and more partners to bring into the conversation to get a strong sense of where if any other funding streams are available, if the city was going to play a part in this, if the the Lawrence Police Force has a part to play in this, and also in terms of the cost of rent and space and all that we do, this could be a really terrific thing for our building. So I just felt like there were a lot of unknowns in terms of actual dollars needed versus a number that that's there, the 40,000. So I agree. It seems to be there's growing consensus that this would be not just appropriate, but is really needed in Douglas County. And I really support it. If we need to put a placeholder in, I support that. I just don't think they're quite ready though to go out and rent a space and get going. I think there are more conversations to be had to make sure we do it right from the beginning and not maybe make some mistakes and wish we'd had a little bit more time.
I think the concept is desperately needed. And both commissioners sort of highlighted that, and I would agree. I would like to see it grow out of an organization rather than start as its own, and if it grows into such a thing that it needs to expand beyond that, that would be down the line. I'd love to revisit with Douglas County CASA and understand why, it sounded like they looked at it and then said it wasn't something, and I just want to understand more from their board about why that wasn't something they wanted to take on. Was it a funding issue? Was it a conflict in mission? Was it a space issue? It seems like I'm supportive of it. I just want to have longer conversations so that this doesn't end up as something ongoing that we need to continually support without a structure behind it just yet. I think a lot of good work has been done, was clear from their proposal. And I think they would even admit that we need to have more conversations, as we develop this concept. There's a real potential for this at the Ridge Court building, and I think I'd really like to explore with Douglas County CASA whether there's an opportunity for us to provide some funding and support, maybe through rent, through a space there in that building. So I'm supportive of it. And if we need to do a placeholder so we show how much, last year we put money for the shelter into our commissioner's budget with the idea that we could come back and then use that later as, sort of as a way to hold us accountable for bringing them back with more clear directives. I wonder if that's an opportunity here, if we're thinking of a placeholder or something like that.
I think that's a great idea because that will make a very big difference in their interpretation of our conversation today, and that we mean it, that we support it and we want this. Interestingly, on the conversation with CASA, and potential not that we can make their decision for them, but co-location in our building with all those other great services, is that I think we spend about $40,000 on rent for CASA since we moved them out of our third floor at the courthouse. And so it is kind of a nice alignment of money saved and money spent on, two services that seem very well aligned. So anyway, further conversation, but I'd be good with putting placeholder dollars in our commissioner account.
On that, I guess, so inside, and this is page 26 of your budget under the blue tab, we have $80,000 ongoing that, we have used for stuff like this. in the past. Let's see here. We talked about using this year for the Heartland money, but, I feel like that would accommodate that if you get to a point next year that you feel like it's ready to go. I feel like we have that authority already inside. I don't know that we would need additional, based off of what the spending was like in 2019, unless the commission feels differently.
I think that's great, Sarah. I mean, that sounds like you already came up with a brilliant solution for this problem. Way to go.
And I do think, like you mentioned, CASA too, and I keep thinking now my brain's really churning on human service stuff, and I do think one of the things to discuss with our decentralized system is, yeah, a lot of people, we're subsidizing rent. Is that really where we want our dollars to go? We want them to go into direct services. Somebody has to pay for rent, but it's I think when we have opportunities like the Human Services Building and the Community Health Building, and it's important that we try to maximize those. And if it's as opposed to necessarily just paying for rent and storefront. And sometimes with agencies where there's so much, there's so much overhead with just having an agency. You got to pay for an audit. There's all these things you got to do if you're a separate, independent nonprofit, that honestly sometimes can weigh you down from your mission. Okay, so we have that one resolved. The Eudora Chamber.
Well, I guess I'll speak to that. I do think we need to figure out some parity, because we support Baldwin every year and have for several years now, I think to the tune of about $20,000 to help staff their Baldwin City Chamber of Commerce. I think that's right.
It's 10,000.
Is it 10? Is it 10? Okay. Thank you. And, so in fairness, I think the Eudora Chamber, deserves our support as well. We have spent a while back, we a market study for their commercial capacity, and they're really grateful for it. It's helped them a lot. So it's not as though we haven't invested in Eudora's economic development efforts. And I think they would say that we've been pretty helpful and generous. I didn't, sadly, I didn't get the impression Mary Kirkendall represented Eudora for their Chamber of Commerce. And it sounds like they're just kind of in a moment of transition where they didn't really have someone who was able to make the case for what their staffing and their program was going to look like. So, of course, I'll support funding them if the other commissioners will, because I know that they work hard and they have a remarkable Chamber of Commerce. Their annual dinner is packed, and it's more and more packed with young people, young business people and entrepreneurs. So I'd like to support that very much. I just wasn't sure if this was the year, but
well, I supported it, and it goes back. I think that we talked about it at a budget probably a couple years ago, if not every year, about the fact that we support Lawrence Chamber and we support the Baldwin City Chamber, and there was always some question about why there wasn't a request from the Eudora Chamber. So I'm glad to see it. I'm not surprised to see it. But once again, I mean, how do you say we're going to support these two chambers, but we're not going to support yours? There has to be some sort of balance there, and
Well,
we're going to support these communities, especially right now. I mean,
I would like to spend some time. I totally agree with the argument that if we're supporting Lawrence and we're supporting Baldwin, we should support Eudora. That's an easy argument to make, and one I'd align with. I would like us to leverage some of our funding priorities with something that aligns with what their population is and what their contribution from their local municipality is as well. You know, and I don't know if that's just sitting down with all of them and saying, look, let's come up with a formula here that we can fund based on, you know, the size of your community, based on the support that you get from your local city council and those things. I just think that seeing, I didn't put it on my list because I didn't get the sense when they visited with us that how they were going to use the money. I was like, I don't know how this happens. What does this look like? And I think it's because they're in a moment of transition. You all might know more about it than I do, but that one sort of took me back a little bit.
Yeah. Well, I want to, let me revisit that. When I think Mary was in an awkward spot because I think she was kind of thrust into a moment that where this, you know, her few minutes with the commission, she just didn't have the information she needed. But I do want to attest to the fact that the Eudora Chamber of Commerce, even though they're having a change of leadership right now, they're highly functioning. They have a great website. They have regular morning coffee meetings. They have, you know, an active membership and a growing membership. And it's, Eudora is an up and coming town, and their chamber reflects that really nicely. So I was disappointed that there wasn't, you know, a presentation to kind of support this request. I have no doubt that they will be able to, you know, wisely use the money and, you know, for the support of their infrastructure and programs. And so you know, I don't know the conversation of whether City of Eudora and City of Baldwin are going to match our dollars, or I don't know how that conversation will go, but I think it would be great if we could signal to Eudora that we want to find parity for their organization. If we have the time and energy to have those conversations, that's great. I can also see just funding them with this initial dollars and going from there. So I'm just delighted to know that you all are in that place of wanting to find that parity.
I guess to that end, in terms of parity, you know, from the request that we have, the City of Eudora does put funding into it, into the Eudora Chamber. Baldwin does not. And I would say that if we're talking about parity, my concern about 12,000 as opposed to 10,000, I just don't want to get in a you know, a tit for tat situation where, well, now Baldwin's going to ask for an additional 2. You know, and so I want us to be, if we can certainly add it to our list to bring back up, to bring in the Lawrence Chamber, the Baldwin Chamber, and the Eudora Chamber for a work session to talk about a fair funding formula. And we can do that before next year's, in plenty of time before next year's budget, if that's the will of the commission.
That would be my preference, because I mean, we're going to come down here next is going to be the Lawrence Chamber, and it's just I don't know how to you know, how to make an argument one way or the other for these different chambers of commerce. And I think it would be good to bring them together and say, look, we're involved in economic development. We want to be in that. We think we have a role to play. But I would like a little clear formula for how we do it. And maybe that's crazy. Maybe we can't come up with a formula because it's going to be 12,000 this year and 14,000 next year, and you know, we just keep mounting that up. But I think these groups have important roles to play. They're really important for their community, especially right now. We're going to ask a lot of the chamber here and the recovery effort, and we're going to need it from Eudora and Baldwin as well. I mean, we're going to need it from everybody. So coming up with that, I like that idea, Sarah, but you know, I'd be interested in other commissioners what you think as well.
Well, so listening to this conversation and knowing that there is support for some level of funding, we just don't know the wisest amount. I'm not sure. I think especially in a tough year, and especially when we are asking more and everyone's needing to do more, I would be interested in going ahead and funding them at 10,000 so that it's even with Baldwin. They, after all, do have their city of Eudora also in support, and but have that, so at least we've brought parity here in the beginning. Whether that is the, you know, whether that's the most appropriate amount, whether it needs to be more, I can't imagine it needs to be less. I think that would be great if we could offer that to Eudora, especially as they're in a moment of transition and probably need all the help they can get to land in the right place. And I do know that they are a group of people who would use it wisely.
Yeah, I'm good with 10,000.
Sounds good.
Okay, so 10,000 ongoing. So we will take that out of the kind of the ongoing mill levy that was dedicated to fund balance.
Yes, please.
Okay, and then we will, and then do you still want to try to bring them in for a conversation sometime this fall? Or a work session with all the chambers to discuss this further as we move to the cut? The next one is the Lawrence Chamber cut. Is there, okay, so I'm not seeing support on doing that unless I'm missing something. Can you guys hear me?
Yes.
Okay, so we don't want a work session. Michelle
No.
just, okay.
But I mean, you know, that's just for the next 6 months. After that, you know, you've got 5 months before your next budget.
Okay, so the Lawrence Chamber cut.
I thought they moved on from it. I'm sorry.
Oh, I didn't. Did you? We didn't discuss it. I was just trying to make sure we discussed all the supplementals. So no discussion on it.
No,
Okay. So then Heritage Conservation cut restoration is next. Any discussion on it?
I understand their desire to get back to their fullest funding, but I think they also understand that this is a year that's not our highest priority. So.
Okay. Then the planner position for zoning and codes.
I supported that.
I think in another year, I would support it, but this year, seeing the other needs that are out there,
Yeah, I'm the same way. Boy, if ever there's a department that deserves, and it really needs an extra full-time person, and they've worked hard in the absence of adequate staffing. They do, but that's where I struggled, was that this didn't seem like the year to be expanding the office.
I'm also interested, Sarah, I know, we haven't talked about joint agreements yet. And then sometimes I get concerned that it seems like our Douglas County group is doing more than we're getting from our partners at the Lawrence Douglas County Planning Department. And so sometimes when I see planner on there, I think that's the Lawrence Douglas County Planning Office and not our zoning and codes group. So it just seems like that's unraveling a little bit, and I'm trying to get a sense of, which duties belong where and who's doing what, and are we picking up some slack so that because it's not being done. And maybe that's clearer than it's clear to me, but I just, it seems like we keep taking on more and more duties from Lawrence Douglas County Planning.
I mean, that's definitely one of the things engaged in this conversation. And, Tanya and I had a brief conversation with the new Planning and Development Services Director, Jeff Crick, about that. Some initial analysis by the city of Lawrence felt that they could justify the amount of funds that we spend, the 1/6 of work of the PDS office. We said, well, there's a whole lot of other stuff that we've picked up, and I think we need a comprehensive conversation about that, and if there were things that we picked up because they didn't, or were they just new things that happened, and weren't really under anyone's plate and fell to county zoning and code. So you're right, that's definitely an area that we need to do more work in, for sure.
I agree, and I think that's kind of a chronic, it's a conversation that's been had kind of quietly for quite a while, and a chronic concern of the representation of especially the rural planning needs, and having, just having the focus that they deserve, in the same kind of it's not values, but the same kind of core sensibilities about rural Douglas County, especially. So, I mean, I was really compelled. I thought this was a great request. I think they need it and would do well to have another person. I just thought not the year to be adding a full-time employee, but as soon as conditions allow, that's where I would be.
Well, one of the businesses that did stay in business during COVID was zoning and codes and construction, and permits and inspections. All of that did not stop during COVID-19. They are overwhelmed. We eliminated a position when Sean left. There's, and it's nothing against them. I take full responsibility for it when I get the emails complaining about people who are trying to get something done, and because I consider it our fault if a department's not fully staffed and unable to keep up with the needs of our citizens or businesses. So that's why I supported it. Their business doesn't stop and hasn't stopped. And they're, I mean, how long do we let them be overwhelmed before we start losing people because they just can't meet the need, and have to deal with, I'm sorry, but some people that get pretty nasty and irate when their needs aren't addressed in either the time that they're used to, or, in whatever unrealistic demands that they're making.
So can I ask that we move on to the next one? And I'd like to do a little more digging and look at that a little bit longer before trying to get any decision on that one.
Okay.
Yeah, and I feel, I feel as the administrator, and this is, this is under my scope. I do think there's a need here, but I'm not sure this is the year for it. And so, I make a commitment to give you every request that comes to me, so you have transparency. And I've had continued conversations with Tina and Tanya about how we continue to meet the needs, and I mean, I'd like to bring you back a little bit more detail, and I can't do that in a day, on numbers and data, to see if really we are where we need to be. So I certainly don't oppose I don't oppose the commissioners continuing to consider it, but I do think it is important to know that, like, the next item on your sheet is something I'm going to feel really strongly about. And, I had a lot of conversations with department heads about trying to keep things pretty flat because we were not supporting our pay. And while I understand right now is not the time for that, a year from now it might be, and we will be another 6 months from a pay increase and losing a whole lot of staff, if that's the case. So I feel pretty strongly that we need to take care of the staff we have before we add more. So I'm not opposed to you coming back to talk about it, but we clearly have a lot of work to do here in this area to demonstrate and justify, I think, a full need. And that's my perspective.
So, Sarah, thanks. I appreciate that very much, and it's good to hear that that hard administrative look ahead too. That's a kind of a fair warning. Maybe it's just that we're getting toward the end of our session and I'm getting worn down. But we'll be revisiting this tomorrow, right? I mean, there's no expectation that we're done with budget today, so we can revisit.
No, and and we can certainly talk about, I think our plan was to start at 11 tomorrow, not at 9.
Oh, that's right. Yeah.
Yeah. So we would have an hour then, and then we do have time reserved on Friday morning.
Yeah.
So, we are real close though here. So I'm really proud of the progress we made. I guess what I was just trying to say, Nancy, is towards the conversation about zoning. I think that, like, this commission has asked us to demonstrate in terms of number and volume on some things, and there is some of that in terms of planning, but we have some work to do as well. And we did take Sean's position and we turned it into a staff position, and have the co-directors. They are advertising to fill Judy Stone's position. That's going to be a big loss to the department, but hopefully we can find someone that can really, bring a tremendous amount of value to the organization. I do think that there are some things we can do here before we expand the staff position, in my view.
Okay. Well, I appreciate that, and it's, like I said, it's good to be reminded of the kind of the dire part of the budget as well, and so happy to reflect that in the conversation tomorrow.
Okay, so is there anything you need from us before tomorrow? And then we'll just pick up sort of if there's any questions on zoning, and then move to just the last 3 items. And then maybe by then, Cammie and I can kind of come up with a CARES Act Plan B fund conversation, you know, what that amount might look like and where we think a good place for it would be in the budget. That's really the only other to-do I have. Unless there's something the commission is looking for from us.
No, I feel like I've got what I need at this point.
Okay, cool. Yep, good call, Michelle, on our website. We'll update it to start at 11.
Thank
that
you.
was sort of a last minute change, so we'll get that changed. You know, this is tremendous. You guys made a tremendous amount of progress today. This is, I'm not sure if I remember a budget where we've made it down to like the last 3 or 4 items on day 1 of deliberations. So thank you all for your dedication and your work on this and moving through it. These are tough, difficult decisions, and I appreciate, as always, your dedication and devotion to the work. So we'll start again at 11 tomorrow, and we may make quite a bit of progress.
Well, remember, we couldn't be at this point without you guys. So it's all your hard work up front that makes it so easy. Or, well, I shouldn't say easy, but yeah, a little less painful for us.
I'm going to point this way because on my screen, Cammie is to my left, and she may not be on your screen, but a tremendous amount of work. This is her baby. This is dedication to it, particularly this year with the struggles with COVID and staff being pulled in multiple directions. It felt like it was kind of Cammie and I putting this whole thing together at times, and so it's been a challenge. That like it's been a challenge.
Well, thank you.
Thank you.
All right. Well, have a good rest of your day, and we'll see you. Oh, we'll see you at 5:30.
30.
All right. Thank you.
Bye.